Tuskegee experiment, while it was, as I said, medical malfeasance, um, that was an example of the medical field or a group of individuals withholding treatment from African Americans. So it's not in that example right there, there was nothing injected or given to them, but there were, syphilis was a disease at the time that destroyed lives, that afflicted many people, especially African Americans. And so a cure for syphilis was found, penicillin, of course. And so members of the community were enlisted and they were advised that they would be receiving treatment, but many of them didn't. And they went about 50 years, if I'm not mistaken, without receiving treatment. So they received lifelong consequences of having the disease. So that was just a travesty, and any way you look at it. And that in and of itself is enough to cause distrust in the community. But you also have instances where members of our community were sterilized unknowingly. There's many different experiments. So any reservation that we have as a community is warranted. But I would also say that when looking at those failures of society and failures in the medical field, we also have to look at the advancements that have been made. Things such as the AIDS epidemic, things like just common things like high blood pressure and hypertension and things of that nature. Like the medical field has shown that advancements have been made that benefit the Black community as well. So, and those tend to be more recent, although I know that bias still exists. We have to weigh the picture as a whole. And when we look at vaccines specifically, there haven't been instances of misuse or mistreatment with vaccines. Vaccines have cured. When's the last time you met or heard of anybody having polio, diphtheria, or rubella, or smallpox? Those diseases have largely been eradicated by vaccines, and vaccines are the sole cause of that. And then almost everybody on the college university has been vaccinated. We had to receive vaccines to enter grade school, for college. So we have to weigh the entire picture when we're having reservations about things of that nature.
Yes, thank you for that, and thank you for reminding me of some of those other situations. I've been thinking a lot about kind of the dual pandemics of HIV/AIDS and COVID, having grown up in the beginning of the HIV/AIDS pandemic, and
Yes.
and how they intersect.
Yes.
And it's been fascinating, and that like there's so much more research that I need to do for myself about that. But yeah, the way that this stuff unfolds and affects Black and brown people deserves its own research and its own inquiry.
Yeah.
So the second question I have for you: do you personally trust the science that went into the development of the current vaccines that are on the market?
Marcus, I do. I guess I have to qualify that with saying that I've been a science nerd my entire life. So even as a child, I used to read chemistry, biology. Like I understood those things as a child, and I've never had any reservations about vaccines. And the you have to think, and I think you spoke on you living through or being aware of the AIDS epidemic in real time. I'm going to age myself here as well, but I remember when there was no internet, no cell phones. As we said, like the AIDS diagnosis was basically a death sentence. I use those examples analogous to the vaccine development because those things are a consequence of technology, of advancements in science. And the science put behind developing these vaccines has advanced. I've seen many arguments where people state that the trial wasn't this long or it wasn't that long, it was too quick, so I'm hesitant to take it. But if I could, again, just dive into what this RNA vaccine is, if you don't mind.
Yes, please do. Please do.
So when you use the normal route of vaccinations uses DNA, and those vaccines contain either a dead or weakened version of the virus that's introduced into your infection-fighting cells. The new RNA technology doesn't have any parts of the vaccine at all. What it does is when it's injected into your body, it goes to your infection-fighting cells, not the nucleus of any cells, any DNA or anything of that nature. It goes and it gives them instructions on how to make antibodies to fight COVID-19 antigens, meaning that once it goes into the cell, the body creates an immune response, it prevents the antibodies, and then it destroys the RNA. So that's how it works. And understanding that leads me to trust the vaccine and the vaccine manufacturers. Now, I'll be the first to admit that wasn't that normal 15 to 20-year study period, but this vaccine has been in development for at least 8 years. And with the advancements in technology, I feel that we can trust the technology that has gone into this vaccine. And
yes, thank you for that. You put it in terms that I think makes it easy for non-science people to understand it. And I keep hearing about RNA, and I remember learning that at some point in school. But but to think about how it's teaching your cells what to do, it's not changing your cells.
Maybe a little off the cuff, but I sometimes find it ironic that the same people that will trust the neighborhood esthetician or backyard doctor to inject their vaccines won't trust the science behind injecting yourself with something that could potentially save your life and others.
Yes, yeah, there is the cognitive dissonance of that is deserves its own study. Yeah, the things that people are doing every day, it's just like pose more risk than receiving the vaccine. So, what should we be thinking about in terms of these new variants that are being discovered globally, and how these new variants may interact with the vaccines that are currently available?
Fortunately, the vaccines that are currently available are providing coverage for the variants that have, or the mutations so far. We're also fortunate that kind of gotten a head start, and we expect the virus to mutate and to produce variants. So there are also, for people that have already been vaccinated, booster shots be developed that you take so often, ever so often. I envision, and I hope that this is incorrect, but I envision that this will kind of resemble the path that the flu went, and we may not eradicate it, but because we know so much about it and can kind of not predict or foresee the variants, that maybe every year there'll be a COVID shot available, but we'll be able to control it like the flu. If for those who may not know, but the flu was once a pandemic, not once, but more than once, and killed hundreds of millions of people. And that was something that we take for granted. We don't see it as a threat to humankind like it was at one point in time, because we know you can take a flu shot every year and you can get in front of that variant of that year. So I think that eventually, if we get enough people vaccinated, through our herd immunity, we'll be able to keep COVID-19 in check, and then we'll be able to provide boosters every year.
Thank you for that. So this is a little bit different. It's not just about COVID-19, but really about the public health community and about the medical field. What steps do you think the medical field and the public health community in general need to take in order to build trust with African Americans? Like what does that look like on the public health side?
Well, I've had plenty of experience in this area, so I can speak on this, like, definitely. Um, First of all, what you're doing, this forum today is a great start in that direction. Studies have shown that recruitment begins in the community. And so when the movements arise in the community, then community members are more likely to follow, and they're more open to receive the messages when they can look at the messenger and they have something, a basic commonality with the messenger. We could also look at direct marketing. If I see a commercial that features someone that looks like me, someone that seems to have a common background, someone that's relatable, then that disarms me. And it allows me to look at that person and receive what they're saying versus looking at the messenger and having apprehensions just upon sight. Word of mouth. Marcus, when you receive your COVID-19 vaccination, you need to talk to people about it. You need to tell people. You need to share it. Like, I took I got my vaccination. I didn't grow an extra arm. I'm not, I might have had a fever for a short term because when you introduce an antigen into your body, it's going to have an immune response. So there may be a short spike in temperature. You may, just want to sit down the rest of the day. But talk to people about it. Like, ease their concerns. Show them what you're doing and what you've done. And I think if we did that as a community, and that would go a long way. And I think that trust it's a two-way street. Like, you have to have the ability to trust someone. We can't be closed-minded. We have to be open to receiving new information, open to challenging our old beliefs. We have to research for ourselves. Look at sources that are not some random person on Facebook. Verified sources, trusted sources, from scientists and professionals in the field. And we have to be open and to listen and to be discerning of the information that we do receive so that we can understand what's conjecture and what has some validity to it. We have to be open, like, given the history of the mistreatment of African Americans by the medical field, I understand apprehension completely, but we want things to change. We have to be open to that change. And I find there's this song by my one of my favorite voices. His name is Sam Cooke, and it's a song called "The Change Is Gonna Come." And I think as African Americans, like, we accept that song, and that song is dear to us. But we want the change to come, but oftentimes we're resistant to it. And for that change to happen, we have to facilitate that change and be open to it.
Yes, thank you for that. It is a two-way street, and I think even I sometimes forget about it's trust goes both directions. Even while you were talking, I was thinking, right, like, we know about smoking. Why would we continue to smoke when we know what it does? So it's like part of it is on us, and then part of it is on the health community to make sure that we know what the risks are for these different habits, these things that we do that maybe we're not thinking about, and then building the trust on our end, right? Like making healthy choices, eating right, exercising, all the stuff we know we're supposed to do. We also have to do those things to show that we get it.
I would also add to that you will see the results. If you trust in the process and you give things an opportunity to play out, then the results are going to show. At one point or another. Let's say we move the African American community by and large to receive the vaccinations, and then in 6 to 9 months, the rates have decreased, and we can go back outside and we can have barbecues again, and we can go to parties and things of that nature. Like, the results will show either it's going to get better or it's not. But we have to start somewhere.
Yes. And so Harold has a question, which is, I'm excited.
I mean, I'm happy that we that video that you showed earlier reference to Hank Aaron, and of course he did end up passing a little bit after. And like, let's talk a little bit about that, how that kind of reinforces some of the fear that kind of comes with vaccinations. I mean, yes, could it be a coincidence, or could it be because he was one of the few African Americans that stepped up and did the vaccination? And so, like, let's talk about like kind of how that can help, that media can kind of help reinforce our issues with vaccination.
Were you able to hear that?
Yes,
Okay.
yes, great question. So, you know, it was big news when Hank Aaron was vaccinated, and I thought it was great. I thought it was fantastic. And then when he passed, I was like, oh, this is one of the worst things that could happen, you know. But knowing what I know about vaccines and about developing immunity once you receive a vaccination, it generally takes a couple of weeks before your immunity to kick in, per se.
Mm-hmm.
So you can get vaccinated, you can be positive when you receive the vaccine, you can catch it anytime in a 2-week window. And I say 2 weeks, but that could be 3 weeks, but around that period of time. So I mean, I think it's a coincidence for the simple fact that many more people have received the vaccine.
Mm-hmm.
Many African Americans. I have relatives. They call me. It's like I have a vaccine. I'm getting my second dose today. That have received it. Millions of people have received it. I mean, we're not where we want to be nationally, but millions of people have received it. Vaccine doesn't kill. It's as far as I know, it's not capable of killing people. There's no COVID is not in the vaccine. There's no COVID in the vaccine.
Mm-hmm.
So let's start there. Additionally, Hank Aaron was 87 years old.
Mm-hmm.
He's what's that? 14 years beyond his life expectancy. And he was, I mean, I really think it was an unfortunate coincidence.
Mm-hmm.
I'm glad you asked that question, Harold, because when you look in the comments of that video on YouTube, that's like the first thing people point out. They're like, you see, Hank Aaron got it and he died. And that, just that one sentence can affect a lot of people in a very quick way, because the way that social media works, right? I didn't have to dig around for that video. It's like the first thing that came up when I typed it in. And I liked what the video was saying, but when you look at the comments, the misinformation can spread instantly. Yeah, the information wars that we are in the middle of it's kind of intense.
It is, and I think that misinformation spreads so much more quickly than the information, and it's unfortunate. You know, we've become accustomed to be weary of things, and that's fine. I think we should all look at things with a critical eye, but I think where society oftentimes falls short is that we don't fight this information with sound information. We often go on conjecture and a lot of times fear. So let's look at things with a critical eye. So that's when we're comparing and we're looking at the alternative. We want to combat that with facts and sound logic.
Yes. Well, so you kind of answered the next question already, but I'm going to ask it anyway.
Okay.
What do you think of the short-term and long-term impacts of African Americans not receiving the vaccination? So you mentioned that it'll take longer to get back to kind of the old way of life, going to parties, being around family. But can you talk a little bit about that, the short-term and long-term impacts?
Sure. Yeah, there are additional areas of impact. I mean, short term, and to me, what seemingly that stands out to me immediately is that the longer that this virus survives, the longer that it spreads, then the more variants we're going to find. The more it reproduces, the more it's going to mutate. You have to think viruses reproduce at rates of millions by a very short period of time. So you reproduce them that many times, then there are going to be mutations in those reproductions, and therefore different variants will arise. People are going to continue to get sick and die. I mean, bottom line, it's going to continue to spread. It's going to continue to make people sick. We're going to continue to miss work. Schools are going to continue to open and shut and open and shut. My kids are going to be sitting in front of laptops, for the foreseeable future if we don't address it. And we'll just continue to live in this new normal. Long term, all of the above, but I think we'll exacerbate the already existing health disparities between minority communities and the majority communities. We'll look back and although there's a gap now, we'll look back and there'll be a 10-year period where this number of African Americans died from COVID-19 or complications thereof, when we kind of perpetuated that by not taking the vaccine. So I think that will be a long-term effect as it relates to the African American.
Yes, thank you for that, and for putting it in those clear terms, because I'm very worried. I'm worried that people will allow the misinformation, allow the distrust to keep them from getting the vaccine, and that this thing is going to last much longer than it needs to. Mm-hmm. It's one of my personal fears. When we think about the kind of recent diseases that were stopped from becoming pandemics, Ebola is a great example. Ebola, the first swine flu, the first avian flu, like those things were kind of caught and contained pretty early. This one was not. And of course, now the public health community is also talking about the next one, that we need to be prepared for the next one and the next one, because it's going to continue to happen.
I have a question.
That there isn't a new pandemic every other day, simply because of the different antigens that exist in our society. There's a constant battle. Like there are things that go on in public health behind the scene because of institutions that were already established, where oftentimes we stamp out these or we prevent diseases from becoming epidemics or pandemics. And somewhere along the line, we had a breakdown or failure to act that allowed things to get out of control. Like you said, Ebola could wreak havoc on the world. SARS, the first SARS, avian flu, swine flu, like the Zika virus. Yes. All of those things could have caused other pandemics, but because we had a swift public health response, a swift and a strong public health response, we were able to stamp those out. And so while we're catching up now, I think even beyond the government's response, like I think we all have an individual responsibility to do our part to help stamp this out as well.
Yes.
And becoming vaccinated is one of those duties.
Yes. So we have a question from someone who's on the other screen. So I'm going to try to communicate. Okay.
Hi, I'm Lynn. I am working to set up the vaccination program here at Austin P. But one of my concerns, and if you can speak to it, is that we have communities of color across the country that are in sort of deserts where they are not near a CVS or a Walgreens or the the local vaccination site. And I see that in our county here, that you have to have a good working car to get out to the vaccine site, which is part of why I made the case to have Austin P be a vaccination site, because we're within walking distance of many of our neighborhoods. But can you speak to how can we encourage more vaccination sites or more participation so that our communities of color that are being left out, who typically are in food deserts and healthcare deserts, can get to a vaccination site?
Yeah, but were you able to hear? You were able to hear that?
I was.
Okay, awesome.
I was. Thank you. The first thing that pops in mind to me is that we have to go to them. We need, like I said earlier, that our efforts need to originate within the communities that are most affected. So I think an appropriate public health response would be to go to those communities, to set up vaccination clinics in those communities, to form a partnership with someone who can provide, or an entity that can provide the storage for the proper vaccine storage for the amount of time that is needed. We start with, I mean, you just don't go and set up one day. You obviously find partners in the community, you advertise, you get the word out, and you take the vaccines to the community. And that's the appropriate public health response.
Yeah, thank you for asking that question, Lynn. And also, Paul, Lynn is our director of, oh gosh, I'm going to get your title wrong. Director of
Emergency management.
Emergency management. That's what I was going to say. Okay. So, and is a part of the team that has made our campus a vaccination site for the county. So Montgomery County, we are way behind on the vaccine schedule. Originally, there were only 2 people who were administering the vaccine at the county health center, which is not enough. And so there's a big effort to increase the number of doses, and we have a nursing program. So our health center on campus and our nursing program will be a part of distributing the vaccine here in Clarksville.
That's excellent. And don't be too down. I know you said that Montgomery County is a bit behind, but the nation is behind. You know, I just think just speaking from a public health perspective, I don't feel that our response initially was swift enough or strong enough. And so that's put everybody behind. But I think now is the time that we can kind of make up some ground, and you know, with a little extra hard work, you know, we all can, and us all working together, we can get this done.
Well, so, and along with that, so now I'm going off my script a little bit. What do you think about there's a lot of talk about Amazon workers delivering the vaccine, or that they should be administering because they have the logistics already figured out. And now we know that pharmacies will also be delivering the vaccine. Can you talk a little bit about these kind of unconventional models for vaccine delivery?
I think following the Amazon model to deliver anything is like excellent. Like, they have revolutionized delivery, no matter what the package is. The issue that I would have is who's doing the delivery, who's performing the deliveries in the administration. There has to be a certain level of knowledge attained to be able to administer vaccines. So Amazon can hire the right people, the appropriately trained personnel, and they can go door to door. I'm all for it. If we can ensure that the storage from point A to point B is what it needs to be, and that the person that's administering the vaccine is trained to do so, then at this moment, I can't think of any reason why we wouldn't employ that method.
Yeah, I think it's fascinating, and it's a different way of thinking about it, but I also think we have a responsibility to think differently and to utilize the supply chains that already exist. So yeah, like I don't know that people are ready for an Amazon delivery system, but I think it's I think it deserves good interrogation. It deserves research and deserves to be considered. Yeah, I think it's fascinating.
Whoever came up with that idea, they deserve a raise or something. It's a great suggestion. It's excellent.
I have another question.
Okay, so Harold has a question.
So do you think that we will ever get to the point where we will be able to have such vaccinations like the flu vaccination and the COVID-19 vaccination be in a different form? Would it be possible to, instead of getting a flu shot, one day be able to take a flu pill? That would at least be a little bit more easier for some of those who maybe are afraid of needles, and that might be an extra fear on top of their fear of vaccinations. And do you think that would ever be like something that we would have in the future? I mean, the flu vaccination has kind of been around for a second and we haven't went to that model, but it also could be because of the temperature and being able to, whatever needs to stay the way it needs to stay to be effective. Maybe we can't put it in a pill form, but just another question of like how, trying to think of those factors that come into play that keep people, period, but definitely people of color, away from getting vaccinations.
Great question. Where you actually presented some of the answers, some of the challenges that would need to be overcome to be able to do that. Before I get into that answer, though, there is another method of vaccination, which is a nasal mist that you can administer through a spray in your nose. It's not as effective initially as receiving an injection into your muscle, but that is available for certain vaccines, for the flu and maybe a couple of others. So that's an alternative to the injections. For the pill form and those other methods, the main challenge would be storage, because in DNA vaccines especially, a lot of times there are live attenuated versions of the viruses, meaning some are dead, some are very, very weakened versions, and you have to be able to maintain the genetic material, meaning that it has to stay at a certain temperature. And you can't have it out for past a certain period of time, and the storage has to be immaculate. One of my early jobs was vaccine management as well, and I had to go around and audit facilities that stored vaccines, and you have to have a certain number of inches between the actual vaccine box and the door of the storage unit.
Wow. So
that the cold air can circulate. You can't have the vaccines too close to the freezer because that would make it too cold and it would destroy the vaccine. So there are many challenges to presenting it in a pill form, but there is a nasal spray that exists. Maybe science will continue to advance to where we could send instructions in, and maybe not so much the virus, and maybe storage methods could be changed, and then we could eventually move to a pill. But as of yet, it's not feasible as of this moment, but who knows what will be available to us in 5 years.
I did see that they are working on a patch version of vaccine delivery, which I think is also it's a different way and gets the needles out of the picture, and it's something that could be administered a different way, but that's I don't think that they're there yet. Yeah. I don't know that the science is there yet. Yeah. So I have one more question for you, and then there's some more folks in the room that may have questions. So we'll open it up for people in the room. But my last question for you is, are you going to receive the vaccine when it's your time?
What do you think?
Well, based on everything that you said, I'm like, well, of course you're going to, but, and you're a public health person, of course you're going to, but it doesn't hurt to ask.
So thank you for that question. Yes, of course I am. I love my family, my friends, the general public, myself too much to take the risk of getting sick. There are people that depend on me. I love them too much to take the risk of getting sick myself. And I could not live with myself if I knew I was responsible for passing this disease on to someone. And it's a disease that's proven deadly. So I feel like it's my duty. It's my duty to protect my family and friends. It's my duty to protect the public. And to be honest with you, like, I just want to get back out here and live again. You know, I want to be able to go into stores without worrying, you know, that I just walk through a COVID cloud, or, you know, I say that jokingly, but that's a real concern. I mean, you can't see it. You don't know who has it. I just want to get back to some semblance of normalcy. So if not only for that reason, it's to protect others. So yes, I will be receiving it.
Yes.
It's taking everything in me to not jump live. I work with EMS workers, emergency medical services, so paramedics, EMTs. I'm in rooms with them, you know, often, and I probably could get a vaccine according to the schedule. But I know there are people like the frontline workers and elderly people and immunocompromised individuals that need to get theirs before me. I just need to continue to exercise caution and wear my mask. But I've thought about it. I've thought about it a couple of times.
Absolutely. Okay, so questions from the audience, there's some people on my screen, there's some people on the other screen. What questions do you all have? Yes.
So I feel like one of the main problems with like the Black community not wanting to take the vaccine is that first I want to say, like, my parents are in the like medical field. I remember initially my response to people not wanting to take the vaccine was like, why wouldn't you want to take it? It's not smart. But I understand that there's a history of public health mistreating the Black community. And so I want to know if there'd be any possible way to sort of alleviate their worries and kind of ease the Black community's tension towards like the vaccine, sort of like having someone almost like explain what's happening and how we created it so fast and other things of that nature.
Yeah, so it's interesting. We talked about a little bit of that before, but I definitely will let our guest speaker answer, because that's the issue. Mm-hmm. What you're talking about is the very issue.
Yes, well, thank you for that question. I think it starts with education. Like, we have to start there. We have to inform the community what is happening, why, the what, when, how, all of that. We need to explain, because I think oftentimes we just internalize a concept. We don't put a face on it. We don't know what RNA is. We don't know how vaccines work. So therefore, we're left to our own devices, and us who are not medically trained or don't work in public health don't necessarily understand the concepts. And I don't mean on a super technical level. I just mean give a clear and concise overview of how vaccines work, how they're developed, and how they're administered. And then I think we have to create the movement within our communities. You said both of your parents are medical professionals. If they receive the vaccine and you receive it, then you are now a mouthpiece. You are now someone that can inform your peers, other people in the community, that I received the vaccine and nothing's wrong. I'm fine. I haven't contracted COVID, and if I did, it was very mild. That's attributable to the vaccine. And community efforts overall, if they originate within the community, then we are more likely to trust those sources. Direct advertising to our community. I mean, make us feel special, support us. send messages to us saying, you are African, this is for the African-American community. We care about you. We care about your livelihood. We care about the children. This vaccine is safe. We'll show you how it works. We'll share this information with you. And additionally, the African-American community needs to be open to receive those messages.
Yes.
So I think those are ways to build a bridge and to open up our minds to receiving the vaccine and addressing some of the health disparities that do exist.
Well, if there are not other questions, I am going to say thank you for your time and for your expertise. I have a handout for the folks in the room if you want more information about kind of the history of the distrust, but also how we move past it. Len, I'll be sure to send it to your email. And thank you all so much for being here. This is such an important conversation. And Paul, I think we may have to have one more of these at some point. So I'll be in touch.
Okay, I'm honored. I'm honored that you decided to have me. Thank you so much. And I just want to let you know that efforts like this is what helps get the message out there. And I personally appreciate what you're doing, Mark.
Well, thank you. This is important. It's very important. Okay. We're losing you on the screen. I don't know what happened. All right. Thank you so much.
Okay.
Bye.
Thank you.